My name is Dr. Peter Lynn, and I'd like to talk to you today about fibromyalgia. Fibromyalgia literally means pain all over the body. It's in the connective tissues, it's in the muscles, it's in the joints, and it can travel. It doesn't stay usually in one area. It travels from upper part of the body to lower part, front to back. Also accompanying with fibromyalgia is chronic fatigue or exhaustion. It feels like a bad night of sleep every day you wake up. Just debilitating, fatigued, you never get enough rest, and when you do, you wake up tired. And that seems to be the patterns of fibromyalgia with chronic fatigue. Now, what I've found, and I've been practicing since 1988, but I've found that over my history and experiences with people, that there's usually some significant trauma in a person's life that begins to allow fibromyalgia and chronic fatigue to continue or to begin. And that can be a physical stress, it can be an emotional stress, and it can be a chemical stress or a combination, which is usually the case of all three major stresses. Now, part of the other symptoms is the abdominal pain, bloating, constipation, diarrhea, sensitivity with the skin. Is when you touch something with your clothes, it's very sensitive. Also, eyes are sensitive to light. The nerve system just seems to be out of balance. And people walk around with these problems, and there's really no way to find out what's going on. Brain fog is one of them, just not knowing how to communicate, get the words out, memory problems. So all these are parts and pieces of what contributes to fibromyalgia and chronic pain. And again, what I've found is that the brain is just part of it's firing too much and other parts are not firing enough. So the brain just seems imbalanced, and that's the case. There's a problem between communication with the brain and the rest of the body, and the body back to the brain again. There's no balance there. And when the brain does fire, parts of it overfires and creates more hormone problems. One in particular, what we're finding is cortisol, which comes from the adrenal gland, and the adrenal glands produce catecholamines, but cortisol really throws off the sleep-wake cycles. And what we find with chronic fatigue and fibromyalgia people is cortisol levels are off the charts. They're not balanced. And so we get a real imbalance in sleep-wake cycles, and that's a big problem. But also, remember what I mentioned about the gut and the digestive system. That doesn't seem to be in balance either. So what we're doing is we're doing multitudes of tests to find out. One of the first things that we're going to do is find out if you have an autoimmune problem. And so we're running thyroid panels, liver panels, kidney panels. We're doing fatty acid and finding out the fatty acid metabolism imbalances, multiple sensitivities like I mentioned, because if you have a sensitivity and you're constantly stimulating yourself with a certain allergen, your body's going to react to it. And that's what we're finding is an autoimmune problem. You're producing antibodies in your system to fight something that's coming in from the outside that you're doing that you don't know about, but it also produces antibodies to your own system, like thyroid or gut. And that can be a big problem, and really you can't get better until you find out what you're sensitive to and if you have any autoimmunity problems. The other points of tests that we do is immune panels. One lady's blood work that I just recently looked at again, we found a raging viral problem, and she's not getting better, can't get better until the viral is under control, and that involves improving the nerves, the immune system, but getting rid of the virus that's plaguing your body. So what I'm getting at, there's 2 points that we're finding out. One is we do a complete battery of metabolic tests, and these are not pathological findings that we're looking at. You can have a test, a blood chemistry panel, a metabolic panel, and have numbers within the range but still be functionally not right. And that's what we're doing. When we see all the test results come back, they could all be normal. But what we're doing is finding pieces and patterns that are not normal, that are functionally impaired. And then when we get these tests back, I go through them carefully, and I can decide if we're going to accept you as a patient, as a person in this clinic, based on the information that we're getting from this hormone testing, antibody testing, immune testing, sensitivity testing, all this blood chemistry, and we can find out really what's going on. So at that point, we can decide if we can help you or not. Then once then the second part of the test, let me continue further, is the neurological part of it. Here's where we can test the brain out in a functional way, not a pathological, not like a lesion, but in functional tests. We can see how your body's moving, working. We can do eye tests, we can do hearing tests, we can do blood pressure tests, and find out how imbalanced your body really is. So we get those two pieces of information, and then we plot a course. And usually with people, they've had these problems for so long, and nobody's really seemed to help them, and drugs just seem to cover up the problems. So once we get this information, we're able to plot a course, and it's usually a long but thorough course of correction to get the person back to, number one, feeling better, and number two, getting the body healed back to normal again. So those are the things that we're going to be doing with the people that come in with fibromyalgia, chronic pain, chronic fatigue, exhaustion. We're looking at many things that really have not ever been looked at before, uncovering pieces of information that we're going to be using to literally change the chemistry, the neurology of the person, and reduce the stress in their lives, because it's very difficult to function with this type of problem. So I hope you got something out of this information today. Please call the number that you're left with, that you have now, to the clinic, and we'll see how much we can help you if we get started with this information. And it would be just a great thing if we could match up, figure out what your problems are, and plan a course of healing and correction. So thanks for watching, and we'll see you next time.